still in the middle of our most painful period of COVID-19 spread during 2020 and during this pandemic. We have talked about this for weeks now. We want to continue to remind you that we must continue to work together to slow the spread of this virus, to prevent our healthcare system from becoming overwhelmed. And while we've tried to explain exactly what that means, I want to try to do it again today. I want to be clear about what an overwhelmed system looks like. It's not like on or off switch, right? It's not like turning on a light and turning it off. There are degrees to which quality of care can be delivered. For instance, whether you have COVID-19 or you're in an automobile accident or if you have a heart attack, the difference between going to an emergency room and being treated within the first 20 minutes or getting in an ambulance and driving for 2 hours to the first available bed is a very different outcome long term. The difference between having doctors and nurses that are working on you that are well rested, that have not been overwhelmed, that have not been working 22 hours a day, 7 days a week, versus those who have, is just a different level of quality of care. We're all humans. And so when we look at and talk about our hospital system, it's not as if one day we're going to tell you, hey, we are getting close to an overwhelmed system, and the next day we're going to come in and say, boom, it's done, we're overwhelmed, nobody can go to the hospital. It's degrees, it's levels, it's Dr. Dobbs and I and his team and our team looking a week out and 2 weeks out and making projections and predictions on where hospitalizations are going and what does that mean to the overall quality of care for Mississippians. And so that's what we're talking about when we talk about an overwhelmed system. If you go to an emergency room in the state of Mississippi today, you're going to get treated. But the question becomes, how long in the future is that a guarantee? And at what point is the quality of that care compromised, not because of the quality of the person necessarily that is treating you is not high quality, it's just eventually there's only so much that one can do. And so we know for a fact that we are stressing the system. We know for a fact that Dr. Dobbs and I are working very hard to lean on our hospital and healthcare administrators to surge capacity. We know for a fact that some of them are doing that, and we appreciate their efforts. And we know for a fact that I, at least, am going to continue to push for even more surge capacity within our healthcare system and within our hospitals. But we also know for a fact that that alone is not going to solve the challenges that we face. There's going to have to be additional sacrifices made by the people of Mississippi. None of those sacrifices are fun. I don't like it. You don't like it. We don't like it. But we are where we are. It is 2020. And in 2020, things aren't like they were in 2019. 2019, I was running a political campaign, working 20 hours a day, 7 days a week, and I never thought I would long for those days, but I can assure you that I long for those days rather than dealing with this virus. But the reality is, it is before us. It is our responsibility as leaders to step up. It is our responsibility as citizens of Mississippi to step up, to help our friends and to help our neighbors. And therefore, what I want you to know today is we're going to make numerous announcements today. We are actually going to make news in doing a few things that we've been talking about for several days now, wherein I am going to either have or will sign executive orders before the end of the day that will go into effect immediately to do the following things. Number one, 6 more counties have made the qualifications for our more strict measures. As you will recall, we initially, almost 2 weeks ago, added 13 counties. We then added 10 more. Today, we are adding 6 more counties to the list that requires, among other things, mask mandates. Those 6 counties are Calhoun County, Holmes County, Lamar County, Montgomery County, Winston County, and Yalobusha County. The largest of those 6, obviously, is Lamar County. In Lamar County, we've had 254 cases over the last 14 days. That exceeds our very objective criteria of 200 cases over a 14-day period, and therefore we have added Lamar County. The other 5 counties are smaller, of course, than is Lamar and some of the other counties that we have added, but every single one of those 5, when you look at their 14-day counts, exceeds 500 cases per 100,000 residents. So we have added those 6 counties, Calhoun, Holmes, Lamar, Montgomery, Winston, and Yalobusha. We now have a total of 29 counties that have additional measures in place. In addition to adding those 6 counties, we are also going to add restrictions for the entire state, which include lowering our crowd limits for social gatherings statewide to a limit of 10 people indoors and 20 people outdoors. We know that it is no safer to throw a party in a parking lot than it is to go to a bar. We just can't be allowing that to happen right now because it is a death sentence for many who come in contact with those who are partying. It may not be a death sentence for those who come in immediate contact with them, but when they go back out into society, when they go back into their homes and they take it to their moms or their dads or their grandmoms or their granddads, it can be a death sentence, either for their moms or grandmoms, or if their moms and grandmoms or granddads work in our long-term care facilities, it can be a death sentence for the ones that they spread it to. So statewide, for those venues that do not otherwise have limitations, and so these are for social gatherings, mainly parties thrown at your house or other places, is now limited to 10 indoors and 20 outdoors statewide. In addition to that, we know that we've seen a tremendous amount of spread in our young people. By far, the group driving these higher numbers, we know, is people in their 20s. I've been talking for at least a week about wanting to do something to curb the spread amongst young folks that are going to bars and making careless decisions. I take no great pleasure in announcing this, but I think it's critically important. And in talking to Dr. Birx and her team on the White House Coronavirus Task Force and looking at states like Texas and Florida where they have completely shut down bars, I've made the decision to sign an executive order that in Mississippi, our bars must look more like restaurants and less like mobs of COVID-19 spread. Under this executive order, bars in Mississippi, both freestanding bars and those attached to restaurants, will still be governed by the 50% capacity restriction, but will now be required to have people be seated to sell alcohol. You can safely sit with a few close friends at a table, as long as that table is socially distanced and you're not in a group of more than 10. You cannot safely crowd up by the bar and mix with lots and lots and lots of people. In addition to that, we will also ensure that there will be a cutoff for alcohol sales at 11 p.m. because we know that that's when these crowds, primarily of young people, throw social distancing out the window. We will not allow sales of alcohol in bars around Mississippi between the hours of 11 p.m. and 7 a.m. We believe that these measures will allow for small businesses to remain open, hopefully to do so in a way in which they can continue to operate continue to pay the bills, but also while limiting the spread of this virus. We had over 1,600 new cases today, and that is a number, as we've talked about, that is simply not sustainable. It pushes us towards almost 6,000 new cases, just shy of 6,000 new cases in the last 4 days alone. We have to do things a little bit differently. We have to be willing to make sacrifices as a state and as a people. We have to be willing to wear a mask in public. We have to be willing to change the way in which we do things. We can't go back to life as normal a year ago. And while I have no reason to be happy at all about any of this, I do believe that if we will now take the stricter measures that are in place and adhere to them, we will make a difference. At this time, I'm going to ask Dr. Dobbs to please give us an update on our numbers.
Thank you, Governor. Today we're reporting 1,610 new coronavirus cases, and sadly 28 additional deaths will be added to the death toll. If we look at how Mississippi stands in the nation, among U.S. states, we're number 9 in per capita cases in the last 7 days. So Mississippi is one of the leading states in the country as far as coronavirus goes. And in the Southeast, we're led only by Louisiana and Florida. If we look at our hospital utilization, we continue to have issues with bed availability. We continue to see increasing numbers of coronavirus cases. If we look at the number of patients hospitalized with coronavirus, we have 975 as of yesterday, which is about 100 more than it was a week ago. We have 279 patients in ICU, and then, as I mentioned as an update, 163 on ventilator. 39% of all patients in intensive care are coronavirus patients, and 36% of all patients on mechanical ventilation are coronavirus cases. We today have 9 hospitals, major medical centers in Mississippi that have 0 ICU beds available. For testing, I would like to make sure that people know that testing will be available tomorrow and also Monday. Of course, we have our daily testing available at the Old Farmers Market on West Street in Jackson. South Haven and Pontotoc, there'll be testing locations tomorrow. So if you have any symptoms of coronavirus or think that you might have been exposed, we encourage you to get tested either through your regular clinic physician, or please use one of these no-cost clinics that are sponsored by the Department of Health, MEMA, and the National Guard. And on Monday, we have testing clinics again in Jackson as normal, and then New Holka and Clarksdale. The only thing that I would like to mention is that we do have provisions available for nursing homes to allow outdoor visitation if there are certain parameters met, such as no ongoing outbreaks or cases at the facility. So if you've been wanting to see your loved one, please contact the home and let them and see if they are eligible for outdoor visitation. We know that a lot of people are wanting to see their loved ones, and we have some guidelines that hopefully will make that as safe as possible. Thank you, Governor. That's all I have.
Thank you, Dr. Dobbs. This time I'll turn it over to Director Michelle.
Thank you, Governor. Just a couple quick things. Number one, just a reminder to everyone that as we rapidly approach the beginning of applications being open for our county and municipality CARES Act reimbursement, FEMA will be offering webinars next week to help assist counties and municipalities with better understanding the public assistance portal available at FEMA. That will kick off on Monday, and there will be a class each day up until Friday. Those links for those Zoom webinars will be available at my website at msema.org. And as well, if you cannot make the timed scheduled Zoom meetings, there are YouTube videos available for you to use and view at your leisure. And then finally, just a tropical update, 4 systems out there. One off in the Pacific that obviously will not affect us. It's threatening the Hawaiian Islands. You do have Hannah that is rapidly approaching just off the coast of Texas that will be dumping a lot of rain this weekend down on the lower southern portions of the state. Tropical Storm Gonzalo is the one that we're watching intently to see what it's going to do over the course of the next few days as it enters the Caribbean basin early next week. And then there is a fourth system that we're watching just off the coast of Africa. Right now it's a tropical wave, anybody's guess. But just a reminder, we are in hurricane season. Pay attention and remember what we've told you about talking points in the shelters. Governor, that's all I have for today, sir.
Thank you, Director Michelle. At this time, I'll open the floor to questions. Courtney Ann.
Governor, can you walk us through the decision-making?
You can continue watching the governor's COVID-19 response on MeTV at 16.2 and on our website right now at WAPT.com, where we are streaming it live. And today, the governor added 6 more counties to the counties in Mississippi under those additional COVID-19 restrictions, including mask mandates. Those counties are Calhoun, Holmes, Lamar, Montgomery, Winston, and Yalobusha County. That means there are now 29 counties under those additional restrictions. Hinds, Madison, Rankin, and Simpson counties continue to be in that group. Also today, the governor adding restrictions for the entire state, lowering crowd limits statewide to 10 people indoors and 20 people outdoors. He says the group driving the higher numbers of COVID-19 cases in Mississippi right now is people in their 20s. So the governor has made the decision that, quote, bars must look more like restaurants to stop the spread of this virus. He says he's signing a new executive order for bars in Mississippi. They will now be required to have people seated to be served alcohol. Plus, the state will not allow alcohol sales in bars between the hours of 11 p.m. and 7 a.m. Also, bars and restaurants continue to be limited to just 50% of their capacity.